Things that we worry about are infectious diarrheas, anything that can be passed on through not being able to wash your hands.
Dr. Julie Sierra is an internal medicine physician with UC San Diego Health. She's also treating Central American migrants in Tijuana's shelters, where as many as 6,000 people are living side by side in tents and under blankets, surrounded by trash and soiled clothing. They share a handful of toilets and have little access to showers.
Mostly what we see there is upper respiratory infections, gastroenterology problems like diarrhea, constipation, upset stomachs. We were seeing a lot of rashes. These people have been traveling together and staying in close quarters, so there's a lot of viral illnesses being passed around. I saw mostly women and children. Actually, most of the women I saw were pregnant, 6 to 8 months pregnant. They've been traveling in that state, and they're very fatigued and very traumatized, quite frankly, by the journey and having to flee their homeland.
Dr. Sierra volunteers as part of a network of doctors organized by San Diego Border Dreamers. It's a group of DACA recipients and immigrant rights advocates. She says they're also working closely with a large group of Mexican physicians.
In Tijuana, there's an amazing group of doctors there in Mexico who are gathering together and coordinating care for these refugees at all of the places that they're staying.
She says they're stocked with donated medications and supplies.
We have medicine for colds, coughs, we have Tylenol, ibuprofen. We even have antibiotics for people that need antibiotics. They have actually a really well-stocked pharmacy at one of the shelters, so if somebody needs something that we don't have, we can easily get it from a pharmacy.
She says one of the next steps is vaccinations.
So we did see a young man with the mumps, and then I know at one of the shelters they saw someone with chicken pox. It's hard to know who's been vaccinated and who hasn't, so that's another thing that we're working on, is making sure that we find out who's up to date on their vaccinations, and if they're not, we can try and get everybody vaccinated.
Dr. Sierra says she also treats migrants in a shelter at an undisclosed location on the San Diego side of the border. She says 70 to 100 migrants are being brought to the shelter every day. These are people who have been granted temporary asylum while awaiting their court hearing. And she says they typically stay at the large communal sleeping facility for 1 to 2 nights.
They get food, clothing, a place to sleep. They get help with transportation, finding the address of where they're going, getting bus tickets, anything that they need.
She says she's inspired to help the migrants because of her previous experience in volunteering in poor countries with the Peace Corps. She feels it's her duty. She's urging other medical professionals to do the same.
We definitely need more help, especially physicians, nurses, medical students, residents, anybody who speaks Spanish. We definitely need more help on both sides of the border.
Dr. Sierra plans to return to the Tijuana migrant shelters on Saturday. Susan Murphy, KPBS News.